In the NHS, we hold a lot of information about our patients, and this can be used for great benefit in research and planning. But for this to happen, we must be able to explain to our patients how their data will be used so that they can trust us to look after it properly. As a National Data Guardian said, everyone who uses health and care services should be able to trust that their personal, confidential data is protected. Sometimes for this research and planning work, we need to be able to join up records. For example, when a patient is receiving treatment in the practice and in hospital for the same condition. This means that there are times when just numbers are not enough, and we have to be able to identify individuals to do this linking. We know that some patients do not feel comfortable with this, and we must respect their wishes. Since the 25th of May 2018, patients aged 13 and over have been able to set a national data opt-out. For patients under 13, someone with parental responsibility can set an opt-out for their child if they wish. By March 2020, this new national data opt-out will be upheld across health and care. Having a national data opt-out does not affect sharing information for the direct care and treatment given to patients. For example, when you have a local system for a GP hub viewing patient records. Using information for local audit in the practice is also considered part of individual care, so is not affected by a national data opt-out. The national data opt-out only applies to the use of patient data for purposes other than their individual care, although there are some such uses to which the opt-out will not apply. For example, where a patient has given consent for a specific research study, in which case the opt-out will not apply to that study. The Type 1 objection, which prevents any personal confidential data leaving the GP record for purposes other than individual care, will continue to apply, at least until March 2020. Patients are responsible for setting a national data opt-out. They can do this in one of three ways. The preferred route for people to set a national data opt-out is online at the nhs.uk website. They can also use a national telephone service similar to the e-referral telephone service, or they can use a paper form which can either be printed from the nhs.uk website or requested from the telephone support line. When setting a national data opt-out choice, people will be presented with a single statement. I allow my data to be used for research and planning, and asked to select yes or no. Your role as a practice nurse is to be aware of the national data opt-out and to be able to signpost patients should they ask about it in clinic. For more information on the national data opt-out and how it affects practices, you can complete the RCGP e-learning module and refer to the RCGP toolkit. NHS Digital provide a checklist for GP practices, as well as tailored guidance for nurses, midwives and care staff endorsed by the Royal College of Nurses and Royal College of Midwives.